Okay, so I'll share the slides. And Stacy, please complain if there's a problem with the slides advancing, because that sometimes happens. So they're not going to presentation mode. Okay, how is that looking? Can you all see the slides? Yeah. And just checking again, is that going forward? Yeah. Yeah.
Yep, it's all good.
Perfect. Okay, so here are details. So I'm Thomas, as I said, and I'm one of the lecturers together with Stacy in creative health at UCL. And I'm also, for my sins, I'm the graduate tutor and the admissions tutor. We have a very small team, growing team. So I have a few other jobs. And we're both also personal tutors between us, pretty much to all of the master students. So you'd be working. We are working very closely with the current cohort, and there are the details which I have on the final slide again. And if any of you are tweeting, please feel free to follow us on Twitter. I know Twitter has become more contentious in the past number of weeks, but if you're still tweeting, if you're still on Twitter, feel free to follow us. So what we're planning to do today is, as I said, briefly give you 20-25 minutes and I actually time myself just to make sure I don't go on for too long. Outline of the program, a little bit about the rationale, a little bit about the structure and the application process. And then if there are any questions, we'd be very happy to take them. But if I'm not making sense, I saw from the chat that most of you are based in the UK. So I presume that the speed of my delivery shouldn't be a big problem. But if I'm talking too fast, if I'm not making sense, if you want to clarify me, if you want me to clarify something, then please just feel free to pipe up or put it in the chat and Stacy will alert me to it. And yeah, very happy to take any immediate or direct questions. So the MASc Creative Health is a master's in arts and sciences, and I'll come back to that, but it's a unique program, although there will be more. So therefore, by default, it's an interdisciplinary qualification, and that's why we were really keen to have that qualification. It's arts and sciences, not arts, not sciences, but both. And there is a new definition now of creative health, but this is the one we've been using from the start of the program as a working definition. And the National Centre for Creative Health, which I'll talk about in a couple of minutes, has come up with this as a definition: creating the conditions and opportunities for arts, creativity, and culture to be embedded in the health of the public. The only caveat, or the only thing I would add to this, is also thinking about nature as part of that. I don't think they are separate. So therefore, the outdoors and nature should be integrated into culture in that sense. And I'll try to address now in the next few minutes of why you might consider studying creative health. And hopefully this will be helpful for you figuring out whether this may be a program for you. So these are some of the things. If you're thinking about any of those things, if you're interested in bringing research, policy, and practice together, if you're interested, maybe you are already working in one of those areas and you want to enhance what you're doing or go further with it, or you're interested in a job in the health or social care sector. Social prescribing is one of the new developments in the National Health Service, the arts and cultural sector, local government, voluntary third sectors, or research. So there's a lot of areas there. And if you're thinking about health in any of these areas, then creative health may be for you. And in particular, if you're also interested in addressing and understanding health inequalities or inequalities more generally, and how we can use creative approaches to counter the social determinants of health. And I will talk a little bit more about this. That will be one of our first lectures. Literally, if you join us next September or early October, the social determinants of health will be one of the starting points. But I'll mention them briefly shortly. Then there's also the other side, why to study at UCL. And I don't want to oversell the institution. I definitely like working there. I've been there for about 8 years, but it is a top university globally, as well as within Europe and the UK. And you can see the pictures there of on the top right is the traditional the Wilkins building, the main quad in Bloomsbury in central London. But on the left and below, you can also see our brand new campus in the Olympic Park. You can see that the orbit, and to the left the Aqua Dome from the Olympics in 2012. And the two buildings at the end of the top slide are our new buildings, and we're currently the one on the left. We've just moved there, and that's the one you see on the bottom. So we are in the Olympic Park campus as well. So hopefully the program is based primarily in UCL East in the new campus, but there will also be opportunity to work in the old UCL campus in central London as part of the program. And just to point out, this is the first master's, the arts and sciences, the first MASc program in the world. And there are a few actually starting this year and next year, and the one after. So we've been followed by other programs, but we were the first to have started that type of qualification. And as far as I know, we are also the first postgrad program exclusively or directly dedicated towards creative health. So we like to think we are innovative, which is sort of in the spirit of what UCL likes to think it is. But I'm not sure how important these aspects are, but there you go. So UCL is an important, as a top class institution, and we think our program is quite innovative. This is a little bit of the context. So in 2017, now, going on 5-6 years ago, the UK Parliament, the All Parliamentary Group on Arts, Health and Wellbeing, published this review, the Creative Health Review, and this is obviously where we take our name from, which was sort of a state-of-the-art sketch out of the role of the arts, as they put it, and creativity in health. As I've mentioned at the start, we want to widen that out to think about other things like nature in that context. But it's sort of a really useful sketch out, and you can access it for free via that web link, or if you just Google APPG Creative Health Report, you will get it. It has over 1,000 references, although they are slowly beginning to be slightly dated because they're from 2017. And it has 10 core recommendations. And one of those core recommendations is the setting up of new educational opportunities in the field of creative health. And essentially, we are the first implementation of that recommendation with a postgraduate program in creative health. As I mentioned, this is the document has stated. So this is the National Centre for Creative Health that has come out of another one of those recommendations. So the National Centre is sort of our partner organization, and another recommendation was that there should be a national coordination on creative health in England in particular, but the UK more generally. And so they were another recommendation, and they have now taken forward the role of trying to implement and to some degree standardize, without stifling the innovation and the creativity, approaches to creative health, in particular in the UK, but also internationally. And as I mentioned, the document is now going on 6 years old, 7 years old. So therefore, there's a review process underway to look where we have come in those last several years since the first document was published. And again, feel free to have a look at that, with the key themes of mental health and well-being, health inequality, social care, end-of-life care, education, and cost effectiveness as well, value for money, and the strategy. So these are sort of the key things that are currently happening with the Creative Health Review. I mentioned assets, and I've mentioned social determinants of health, and that language comes from Michael Marmot, who is also as a professor at UCL, who has set up the Institute for Health Equity. So a lot of the focus that we are taking on health inequity, so inequalities, and how to achieve health equity, comes from the work of Michael Marmot and his team. And in very simple terms, what the social determinants are is a range of factors that can help to alleviate health inequities, but at the same time recognizing that a large number of health difficulties are caused not directly by medical conditions, but are caused by the circumstances within which people live, within which they are born. And therefore turning that around and turning that into assets and finding the strength within the system. But clearly, because of that, because so much of health issues are caused by non-medical problems, we know that health services can't really help us address those issues, and in particular the inequality side of things. And therefore a focus on communities and assets in the local areas and so on is really important, and it's therefore central to what we do. And I'll come back in a minute how that's central to the Masters in Creative Health program. Before I do that, just very briefly about the structure. So like most master's programs, it is worth 180 credits. And of those, you would be taking 60 credits, which is essentially 4 modules that are 15 credits each, of a compulsory core that every student has to take on the program. And then there are 2 optional modules that are, again, usually worth 15 credits. So 30 credits optional modules. And if you're quick at maths, you realize that's only 90 credits. And the other 90 credits, so the other half of the program, is made up by the dissertation. So the dissertation, the research project, is a really big part of the program. And I'll say more about that on the next slide or the one after. So just very briefly on those 4 core modules. So there is Arts, Nature and Wellbeing, which is essentially the Creative Health 101, which is the outlining of the key practices, policies, where things are at, the key thinking, and some of the key interventions that we might want to focus on and think about on creative health. So you would be doing that in the first term of the first of when you start on the program. And then there are the other core modules. There's one on interdisciplinarity, which is a general kind of introduction to, especially to those of you who might be new to interdisciplinary working, because we appreciate that most students come out of a single disciplinary degree. But even if you come from an interdisciplinary degree, it's probably useful to kind of come to a common denominator and critically think about interdisciplinarity. Another module is lived experience, where we bring in a lot of people from outside the institution who are drawing often on their own lived experience of health and health-related issues, or working in that field as practitioners or policymakers. So it's about foregrounding the idea of expertise by experience, as opposed to more traditional forms of expertise, which academic expertise, professional expertise, but actually looking at the value to be gained from expertise by experience and the contribution. And then research methods in arts and sciences, does what it says on the tin pretty much. It's about getting all the cohort, and it's usually a very diverse bunch, at least for the first 2 years of students, and we can talk a little more about this in the Q&A maybe, from lots of different backgrounds, and getting them all to common denominator, that everybody can work with at least some basic statistics, can apply some key research methods, both qualitative and quantitative, and maybe also some creative methods. So it's bringing that together. Okay, I've already mentioned you can also pick 2 modules from elsewhere in UCL, and there's a list on our website. And if you look at the hyperlink there, and we can put those links in the chat when I'm done, you can see the modules that we have suggested you could take. Finally, then there is a part-time option. So you can take those 180 credits full-time in 1 year, or you can do it part-time over 2 years, in which case it's not quite split 50-50 because the dissertation is so large. So in the second year, you'd be doing 120 credits, and in the first year, you would therefore only be doing 90 credits. But it's you'd only be doing 60 credits. But apart from that, it's it's over 2 years. And then there's also an option to do a graduate diploma or graduate certificate in creative health as opposed to the full master's, which if anybody's interested in those, then ask me at the end and I can tell you how they are different from the full 180 credit master's. But but there's no point spending too long on this if all of you are interested just in the master's program. So I mentioned the dissertation being worth half of all the credits, so 90 credits go on the dissertation. And these are some of the partners we work with, because all the dissertation projects for the students are community-based, meaning that the student co-designs and develops that dissertation with the partner organization. And the slide is a little bit dated, we should update it, but it looks nice with all the different logos for organizations. But you can see there's a whole spread of partners. There are large hospital trusts like UCLH. There are national organizations like HUK, and then there are very small organizations as partners as well, like Wilder by the Woods or the Hackney Playbus and organizations like that. So there's a whole range. With the majority of organizations are probably more on the smaller voluntary and community sector organization end, but also, as I said, some larger ones. I'm very happy to talk more about the dissertation project, but in a nutshell, as I say, it's about co-developing a project that addresses a real need for a community organization, and then working on that for about 5-6 months for the full-time students, and about 16 to 18 months for the part-time students. Okay, then nearly there with my slides. Just something that might be useful, I guess, is the admission criteria. And the general UCL admission criteria are a 2-1 upper second class degree or above, the 2-1 or first, on almost pretty much any bachelor degree that you might want to have taken. But you know, so we get students from anthropology, biomedical backgrounds, but also obviously arts and humanities and social sciences, and a few from things like nursing and occupational therapy and so on. So I haven't seen an applicant where we say based on their undergraduate degree that they are not suitable. It depends what you want to make with it, right? So I don't think we have had many that have done marketing and things like that undergrad. But again, I can't see a reason why, in and of itself, that should be a problem. So almost any undergraduate degree, as long as you can make the case for why creative health is a good next step for you. And in addition to that standard entry route with this 2-1 or first in an undergrad program, we also consider applicants who don't quite meet those criteria if they can demonstrate equivalent background, professional, personal background in the field. So if somebody has a 2-2 on the undergrad, but has a few years work experience in the voluntary sector or the health services, then that's perfectly fine. We even have a few applicants every year who don't have an undergraduate degree, but have 20 years work experience in the health services. And again, then we make a case that they should be accepted onto the program. So that's the non-standard route. Okay, so I think that's pretty much my formal presentation finished. I'll leave this slide up just for a minute or so if you want to take down those things. And then once I've stopped sharing, I will paste those links that I had on the slides into the chat, so you can access them yourself, because you obviously can't click them on the Zoom call. But apart from that, that's me, and I'm very happy now to take any questions. So I'll stop sharing, and I see there's a few things in the chat. I wonder if there are questions and I'll start with this. Yeah. So over to you, Stacey. Can you see any questions in the chat?
There have been no questions so far.
Okay.
Oh, Simina has a question. I'm interested in the diploma and certificate. Can you say more about this?
Yeah, absolutely.
Just to add, I'm interested also if there are like part-time options for the diploma and certificate, and how that would look like and how that would work.
Yeah.
Thank you.
Okay, sadly, at the moment, UCL doesn't allow that. We realized the need for this because, in particular, people who would want to come onto the diploma or certificate might be obviously working in the field and do this almost like a continuing professional development route. But at the moment, that's not allowed. We're working on that. So, but I'll tell you briefly how the diploma and the certificate work at the moment. And as I said, they need to be taken full time. So the certificate is very simple. The certificate is essentially all our 4 core modules, and that's it. So it's the arts, nature, well-being, lived experience, research methods, and approaches to interdisciplinarity, and that gives you the 60 credits you need for a graduate certificate in creative health. Whereas the diploma is the 4 core modules plus a research project, which is smaller than the dissertation. So it's a 5,000 as opposed to the dissertation is 15,000 words, whereas the diploma, the research project is a 5,000 word project. And I think if I do the maths, I think there's definitely space for one of the optional modules as well. So it's essentially just a smaller research component to the diploma compared to the full masters, that you don't have a big 90 credit dissertation. Is that enough information, or would you like some more on that?
Yeah, that's very helpful. And in terms of time commitment, because as you said, in my case, I'm already working in the field, and this is kind of future development. In terms of time commitment, how much would you estimate that would take per week for the
masters? Yeah,
for the certificate. I mean, for all, really.
Okay.
That would be very helpful. Thank you.
Yeah, we have only started offering the certificate and diploma for this current academic year, and we have currently 1 student on the certificate. So if you're really interested, then we might even be able to arrange a conversation with them directly, how they have been finding it. But yeah, I'll also say, because obviously there's a few interested in the masters, so I'll say a little bit more about time commitment. In UCL speak, every 15 credit module is should be equivalent to 150 hours of work altogether. So that's a combination of class time, of assessment, and independent study time if you want. So you can do the maths a little bit. With the 60 credit diploma over the full academic year, that should be worth 600 hours or thereabouts, whereas the full masters obviously is 1,800 hours. And half of that should be spent on the dissertation. Now, on a week-to-week basis, the way this looks is that on most of our modules, we have, so arts, nature, well-being as an example, we have 5 contact hours a week. We have a 2-hour seminar and a 3-hour workshop. And on lived experience, which is sort of at the other end, that's because it runs through the whole academic year. We only have 2 contact hours a week, but not just for one term, but for the whole academic year. And that's sort of the range. And the other 2 modules are in between that. So between 2 and 5, 6 contact hours a week, and the rest then tends to be project work, assessment, and independent study, if that makes sense.
Thank you. That's very helpful.
Vanessa has a question about if I want to be a health policymaker eventually, would this course or public health be a better choice?
It's very difficult being pitched against.
What I was thinking is public health would be more focused on epidemiology, pathology, and we're more focused on interventions and communities. But you can also take optional modules in public health in the public health department.
Yeah, I think that's a great answer. And yeah, so there is a difference there, that public health is more focused, as Stacey says, on the traditional health services, whereas we obviously mentioned the health services, but the focus of our program is not on health services, not on health delivery in the traditional sense, in hospitals, care homes, doctors. The focus of our program is about the health and well-being elements that are within the assets within the communities. It's a different way of thinking about health and well-being that doesn't start with health services and health service delivery, if that makes sense. And so that's the difference. So it depends then which area of policy you want to go into. If you want to go into public health policy in traditional sense, then maybe public health is the better degree. If you want to think about health policy in relation to community and the future of health, then maybe our program has slightly more to offer. But yeah, very happy to have more detailed conversations about that.
Are there
Thank you.
Yeah, thank you. Are there any modules focusing on psychological theories about creative health?
So we do bring in some of the theory into our modules, but there's also the option of taking more hardcore, if you want, psychology modules outside of our department. For example, with the psychology department or with surgery and so on, they do exercise psychology or performance psychology. That's one of the very popular modules. Or more traditional psychology of health and well-being is another module that some students are taking elsewhere. So we don't foreground psychology, psychological theories. They are part of it, but there's an option to take a more mainstream psychology module as part of the program with another department, with like the psychology department or somewhere else in UCL. Any other questions? Anything else I should expand on? I tried to do things relatively quickly, so we have time for questions.
Sherry asks when the program will start processing applications.
It's already started, so we're open for applications, and there's a process. When they are submitted to the central graduate admissions office, and then they screen them for make sure all the details are correct and everything, and students are eligible in principle, and then they come to us to make an assessment. So we've already started that, and literally today I've made the first couple of offers as admissions tutor. So we've just started making offers. So we will be making offers on a rolling basis, but we are careful at the start of making offers because we realize that most applications will come in the spring, closer to the actual admissions deadline. But there's nothing stopping you. If you're already sure you want to take this program and you have all the things in place, then please feel free to apply now, and we're making offers on a rolling basis. Preliminarily, I think the deadline will be the 31st of March, probably, just to add that for applications. But if you're ready to go, there's no need to wait. And again, then once I've made an offer, we've made the offer, then there's another process. It goes back to central admissions, and it can take a week or two before the offer then comes back to the applicant. But yeah, we have started considering applications already.
Rebecca has a hand up.
Hi, yes.
Oh.
What's the maximum amount of students do you take?
Okay, well, I think we've reached that maximum this year. We hadn't planned to already get to the maximum. We planned to kind of ease ourselves in over 3 or 4 years, but this is the second year, and we have 36 students now, and we wanted to have, I think our steady state was always meant to be 35, because the way we work and the kind of activities we do, we try and keep the groups relatively small. So we don't want to, this is not a mass educational enterprise with large lectures in theaters. We do things very much engaged and interactive, and therefore we want to keep the cohort quite small. So 35 is what we are aiming for give take. As I said, we've already exceeded that by 1 or 2 this year, but this is sort of the number.
Okay. And do you have an age limit?
No, absolutely not.
Good.
So we've had, just to tell you, over the last 2 years, we've had students, well, there's a lower age limit, you know, you need to, being able to at least graduate from an undergraduate degree. So I think mathematically that's probably not possible to do before the age of 20 or 21, I guess. But yeah, we have students straight out of undergrad, which tend to be the minority though. And then every year we have a handful of students who are in the 40s, 50s, and even above. So we have, yeah, definitely a couple of students in their 50s this year. Last year we had a couple of slightly older ones. And then the majority of our students actually tend to be in the middle between the ones straight out of undergrad and the oldest, the more mature students, sort of in the 30s and 40s, having spent 5-10 years, late 20s onwards, I guess, having spent a few years working as professionals in the health services, in the art sector, in the community sector, and then coming back to us. That seems to be a very common pattern. But as I say, there's also obviously students straight from the undergrad.
Okay, that's really encouraging. Thank you. And I've got one more question, if that's okay.
Go for it. Absolutely.
Yeah. So I have a spinal condition, so I'm not very good at sitting down for long periods. So when you mentioned 3-hour workshop, how does that? Yeah, what's involved with the workshops?
Yeah, so you won't have to sit for 3 hours in the workshops. In the seminars, it depends, but we always take breaks, of course. And we have another student at the moment actually with a spinal condition. Yeah. They are using a walker, if that one of the ones with the wheels, so not a full-blown wheelchair, but one of the walking aids. So with the workshops, they tend to be hands-on as best as possible. I'll give you some examples. So first week of Arts, Nature, Wellbeing, we focus on nature and health, because for the workshop we want to do something outdoors, and the earlier we do that in the academic year, the earlier we do that in October, the more of a chance we have of staying dry and warm. So we in the past we've done some gardening with Green Gym UK. This year we worked with an organization called the Visionaries in a local nature reserve in London. So we always do something hands-on like that. Then another week we might be working with clay as part of the focus on art making and health. Or we will have a session where we focus on movement and breathing and do something with somewhere between various approaches to creative movement and yoga. So these are the types of workshops we do. So very few of them will involve sitting down for 3 hours. And as I said, even if there are some where, you know, now towards the end of the term, the workshops tend to be more focused on, there's also one in museums, actually, we've just been to the Science Museum, but the workshops this side of term tend to be more focused on the assessments to some degree, because the students want to know and want to get some more feedback on the assessments. So those are then more kind of seminar based, but we'll always take breaks so they, you know, so you get to move around a little bit. I hope that's helpful.
Brilliant. Thanks very much. Great.
Is there any more questions in the chat? I'm not sure.
Yes. After completing the course, what are some advantages or things that will set students apart from other professionals involved in health practice or health policies? Great question.
And we really need to start asking the students who have just graduated. So we've just had the first set of students graduate from our first, well, they haven't had the conferral yet, but they've just been awarded the degrees informally. They've just been passed by the exam board. And yeah, we're obviously on the second year only. But what we've envisaged is that this is in line with that development on creative health from the All Parliamentary Group and elsewhere. It's a whole new field, a whole new way of approaching health. I'm saying new, but actually many of the practices aren't new, but they have been recast in parallel to, not in opposition to, in parallel to the traditional biomedical model. So it's about being able to navigate those very different worlds, sometimes silos, of the cultural, creative nature sector on one hand and the health services on the other. So what we think sets our students and graduates apart is that they are comfortable between those two worlds, that they can communicate with clinicians and understand evidence from a clinical trial or a systematic review of an intervention, as well as being able to communicate with freelancers and creative practitioners, maybe being creative themselves as well, practitioners themselves, but also communicate in a community setting and communicate those complex, often jargon-laden health issues in a more day-to-day language with people who don't come from a health background, and vice versa, because so the language is very much the unparalleled tracks between these different worlds, and so navigating between those worlds, and hopefully also thinking outside the box, thinking about different interdisciplinary creative approaches to how we can tackle some of those key health challenges that we are facing. You know, we are in an aging population across the Western world, so therefore that will bring a whole range of issues. The endemic health inequities that we are facing in this country as well as elsewhere, and clearly the services, we get those news headlines every day about how ambulances are at breaking point, how people on hospital trolleys, how social care is underfunded. So we need to do something different, and hopefully what we are hoping is that the graduates from this program will be part of that difference, will be part of this movement of changing things and introducing new approaches to health. Any other questions? I hope that answered the question. Feel free to follow up if I've only partially answered any of the questions you've been asking. We have another 6-7 minutes at least to answer questions if you want. I mean, if you're all happy and ready to go home, that's fine.
I have one more question.
Go for
Sorry.
it, Vanessa. Absolutely, no, don't apologize. That's what we're here for. It's better to it's much easier to ask these questions now rather than having to do it then via the email address. So please ask away.
Will there be any focus in disease in any module?
In our modules, there's not an explicit focus on disease because we don't have an explicit focus on healthcare. Obviously, you can take modules elsewhere that are specifically focused on disease, whether that's from a humanities perspective. We have a medical humanities program that our students take modules from, where they specifically look at that lens of disease, or some of the more medically focused modules. What we do have is we do have a bit of a contribution to some of our modules that look at interventions that are specifically related to diseases or specific conditions. And also there is a bit of an input on a very small one on arts, nature, well-being, for example, on global health, and therefore thinking about how do people in different parts of the world think about health and illness. But yeah, also on arts, nature, well-being, the assessment is a rapid evidence review. And I won't bore you too much unless some of you are really interested in what that's all about. But it's a short review exercise, relatively short review exercise. And students get to choose a topic. And on those, you can, of course, focus on something that is specific to a certain condition. So people living with cancer, particular interventions that benefit people living with cancer or people living with dementia, if you want. So then there's an opportunity for you to focus your research on that, if that's what you're interested in. And similarly with the dissertation, we have partners who support particular groups of people, like people with brain injuries or people with dementia, people who are living with stroke, people who are living with the consequences of trauma and so on. So that, again, that's possible then to work on the dissertation side from a research perspective, if you want, on that. But in the thought components, the focus on disease is relatively minor.
Thank you.
There's 2 more questions in the chat. Given that the program is so new, should we have any concern about the reputation of the program and hiring prospects?
Perfect. Thanks for that question. I hope not. And this sort of expands on the question of what sets MASc graduates apart as well. I think the fact that you end up with a MASc degree, not an MSc or an MA, is actually an asset, rather than a threat in a way. And we have this experience on the undergraduate program that we run at Arts and Sciences, which is the BASc, which is quite a unique qualification of Bachelor Arts and Sciences. And I can talk to that a little bit more because that program has been running for 10 years and I've been on it for 7. That our graduates, what they say is that at job interviews, they are almost always asked what those letters mean, right? Whereas if you have a BA or BSc, similarly with MA, MSc, they're just taken for granted and nobody will ask you about it because it's so well recognized. Whereas if you've been asked, what is your qualification? That gives you an opportunity then to talk about what you actually did and why the MASc stands there and what it stands for. So similarly with the program more generally, given it's and it was a really hard process for those of us developing the program to get UCL to approve the MASc qualification, but we thought it was really important. But given the fact that UCL, one of the biggest and strongest universities in this country and quite a big player globally, has underwritten this program, gives a lot of clout. So I think that's enough. So I wouldn't fear that any master's program coming out of UCL is seen as not worthy of employing somebody, because that's the insurance guarantee, if you want, is that it is still a master's from UCL. But actually the fact that it's an MASc, a not very well-known qualification, can really be an asset because it can be a conversation starter. So as long as you're ready for that, being asked the question, MASc, MASc, what's that? And then you can actually launch into talking about what you've been doing, and that can really be beneficial, I think, for job interview situations and more general conversations with potential clients or partners in a work professional setting. Is that okay, Suzanne, or would you like to follow up on that?
No, that's very helpful and good to know. Thank you.
And the second question then on the PhD program, we've just launched it. That was the next step after having launched the MASc 2 years ago. We've just launched this autumn our PhD program. So I can find the website for you. Unless Stacey, are you, if you are on, if you might try and find our PhD program link, we can put it in the chat for you. And that's just opened for applicants for the 23-24 intake. So yeah, by the time you've graduated, assuming you start next year in 23-24, the PhD program will be a year old or so. So you could, in theory, continue straight on, but the opportunity is there to do one with us. The PhD program is interdisciplinary, so it's not just, thank you, Stacey, it's not just creative health, but it has a strong, given our department's position within that, it has a strong creative health dimension. So we'd be very open to having applicants who are interested in doing creative health related PhDs.
I have another question.
Yes, go for it.
Would any of the modules for this course be optional modules for public health? Because I studied human biology and I really like, to go further into disease, etc.
Okay.
But I didn't want to work in the lab, which is why public health sounded interesting to me. But I also like how in this course you can think more outside of the box, especially me from like a third world country and knowing the health system. I think that this course would be very helpful, but there's also my love for science. So I'm a little bit confused about which way to go.
Yeah, no, I can see that dilemma. So I can't comment on the structure of the UCL public health program. I know there's an MPH, a Masters in Public Health, that launched a few years ago. By all accounts, a very good program. I don't know. It depends whether they allow students to take modules outside of their program. Some programs do. I know the Health Humanities program does, and every year, or most years, we have a student or two from Health Humanities on one or the other of our modules. we can't guarantee that. If we're completely full and we can't take additional students, then that might be more difficult. But in principle, we allow students from other programs, but I can't comment on public health in particular, whether they allow that. So you need to look into that from that end. But in theory, it's possible to take another master's program at UCL and take one of our modules.
Okay, thank you.
And again, if you're very keen, Vanessa, to talk to somebody from a more sciencey background who has taken our program, then we can potentially arrange that as well. So if you want to follow up with an email, and we can potentially set up a conversation, or at least ask one of our students or graduates to see if they'd be willing to have a conversation with you, because we have a few that did biomedical degrees, for example, and then went and did the masters with us. So
I'm very interested. Yes.
Okay.
Do I just put my email on the chat, or do I email you?
If you email the MASc Creative Health email address, that I put it in the chat for you.
Okay.
Then I think that's the best way of proceeding.
Okay, thank you.
Okay, it's 5 o'clock. So are there any final questions? Happy to take one or two more. If not, I'm also happy to let you all go. I know it's late on a dark and cold evening, as I said. All right, I hear silence. I can't see anything in the chat. Stacey, can you see anything in the chat? All good?
Oh, sorry, I can never tell when I'm muted. That seems like all of the questions.
Okay, perfect. Well, good timing, just finished. And thank you so much for joining. I'll stop the recording. And